You mentioned that you have a 7-week-old little boy who's had some issues with reflux. You talked to the pediatrician and they prescribed medication, which seems to be helping, but you're wondering if there's anything else you could possibly do to help him. And it's good that you talked to the pediatrician that it's helping, but generally speaking, there are some things that parents can do to reduce spit up in babies. GERD, or gastroesophageal reflux disease, is usually caused by just a mechanical hitch. A lot of babies' digestive system is still developing after they're born. One of these things is the little trap door that's over the stomach that prevents stomach contents from going back up the esophagus. With time, as this fully develops, that it usually resolves. Sometimes this can be when the baby's like 8 or 9 months of age, but until then, you might notice just passive expelling of the stomach contents after they've eaten, especially if you're burping them and an air bubble comes up with it, then they might have some of the milk spill out with it. That's totally normal. It becomes a problem if the baby is projectile vomiting, like having stomach contractions that are causing a lot of vomit to come out of the baby. This can be a problem because they're not keeping food down. It can lead to failure to thrive. They're not gaining the proper amount of weight or getting nutrition and hydration that they need. And so this is when it becomes a serious issue and the pediatrician needs to intervene. So again, it's good that the medication is helping. A few other things you can try. One is just keeping your baby upright for at least 20 minutes after meals. Also, make sure that his pants aren't too tight. Any extra pressure on his abdomen can cause stomach contents to come back up. Don't do tummy time right after meals. Sit him up while he's eating so that he's not laying down and gulping in more air. That will cause more gas and he'll probably burp up more milk. So these are just a few things to keep in mind. And if you have more concerns about it, then talk with your pediatrician. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.